to our witnesses here today for sharing your insight. It's a tough job out there that I think you're trying to do, and it's frustrating from our standpoint. I get especially frustrated when I hear from providers wanting to do the right thing, and yet it is so cumbersome, it is so complex, that even doing the right thing has become so difficult. And I'm afraid that that's just getting worse. And we know that Medicare is on an unsustainable path, at least that's my opinion, and we need to make some changes. We did hear about the embarrassing situations of improper payments, Ms. Jarman, and how, I mean, any of you, how do these improper payments happen? What can you tell us is being done to fix this? Dr. Agrawal?
Sure. One thing I would just want to clarify is certainly the improper payment rate is a huge focus for the agency, and we are focused on reducing the improper payment rate. I just want to differentiate that rate from a measure of fraud. The improper payment rate is not a true measure of fraud. It is really more a measure of perhaps waste and abuse. A lot of the major drivers of the improper payment rate are insufficient documentation, which is often caused by providers sometimes not understanding regulatory requirements. But if we got the documentation that was required, chances are those claims would have been just fine.
So services for a dead person, how does that happen?
Yeah, so there are, you know, we
would
utilize—
that be fraud or would that be improper payment?
It could be either. I think obviously, you know, establishing fraud depends on establishing intent, and that really is a law enforcement determination. What we do is we look at drivers of improper payment and try to go after the biggest drivers. With respect to dead beneficiaries or dead providers in specific, we work very closely with the Social Security Administration to get information on their death master file and to be able to link that information to our own data so that we can stop claims from being paid for those beneficiaries or to those providers.
So would you say that current measures are sufficient, more measures are needed, lack of enforcement? How would you sum up what the current situation is or needs to be?
Well, I think if you were to look at the improper payment overall, certainly you know, there is more that we can do, and we are working on various initiatives to decrease the improper payment rate. Again, because documentation issues drive a huge portion of that rate, we are working with providers to educate them on real documentation requirements. Some of the other things that drive the rate are medically necessary services, but being provided in the wrong place. So again, that does come down to education and working with providers.
The wrong place. Could you elaborate?
Sure. So there might be a service like a stress test, for example, that's provided in an inpatient setting that could be provided in an office or outpatient setting. That inpatient claim would actually could potentially lead to an improper payment, you know, depending on how it was documented and all that. But, you know, nobody's contending necessarily that the service should not have been provided. It should just have been provided in a more medically reasonable location. So a lot of that, again, does come down to working with providers. I take your point very seriously about provider burden and agree as a physician myself that we should do whatever we can to lower burden as feasible while still meeting our obligations to protect trust fund dollars and educating providers as best we can on the front end so mistakes are not made.
Well, I would also add, as I have in previous hearings, in working on healthcare issues, especially in rural America, there are arbitrary regulations that I think might be intended for greater efficiencies, and yet the result is the exact opposite. And I'm afraid patients actually suffer as a result of the federal bureaucracy, and supposedly in the name of striving for efficiency, but services are worse. I think it's arbitrary, and I would hope that we could have your cooperation as we do move forward on trying to find some efficiencies there. We know that hardworking taxpayers need protection, so to speak, and that we have, I think, many options ahead of us. Hopefully we will pursue that will have the federal government step back instead of step forward and into the lives of so many patients, because I think it's counterproductive. Thank you. I yield back.
Thank you, Mr.